I think there is a lot of good interaction that has been happening as such in the course, the various sessions that I have attended, and there is a presence both from the doctors, as the practitioners, the experts that are available, and also from the government side. So I think it is giving a good amalgamation of the information that we are actually getting out of it. So pretty useful. So Palash, as such, I'm heading Palash as the CEO of this organization. It's having around 100 plus customers spread across around 15 countries. It has got two sets of products, as we call it, two product lines. One is legacy, which caters to the existing way of we are generating revenue, while there is a forward-looking new generation product suite that we are having. It's called a Swarm. Which actually gives a facility to have mobility, social media, analytics, big data, actually part of the whole journey that we are setting up. There are two dimensions to that. Definitely, one way is there is a lot of data. The data has already been there. Now we are calling it as big data. There are three V's that we define big data as: velocity, variability, and variance. Definitely. So big data is definitely there. There are insights which are getting created now. So the story is definitely good. It is going to sell. That's a commercial view of it. Whenever we talk about application of that commercial dimension to reality, if at all we build a mathematical model and it is generating some inferences out of it, who is going to own that is a very key question, and that's still unanswered. So to a certain extent this will roll, but when it comes to actually final decision to be taken and the question about who will own it, who will own the decision, who will bail the cat, that will be where actually it will a little bit go slow. But the way that I saw the fraternity taking it is, if at all we are able to get the trends out and we are able to say that we are getting it at say 85% of confidence level, if we are able to document that and the current systems are able to do that, that's also sufficient for them. I see a lot of potential currently in the healthcare. If I have to look at it, we are going to have very huge impact of mobility. Everything on the handheld device, health on a handheld device is a paradigm change. We are looking at complete health information system getting available for patients on a handheld device. Similarly, the other stakeholder is a doctor or practitioner. Most of the functions that you have are going to be available on a handheld device. So mobility will definitely play a major role. It will explode. It's going to be a non-linear growth that we will see, and that is going to impact a wider audience as such. So I see a lot of explosion and growth of IT actually generating in the healthcare industry. The challenges, definitely, I would say that there has to be regulations to really see this explosion happens in a gradual way. Currently, if at all we talk about the electronic healthcare record that we have, who owns that legally? Whether it is a patient that who is owning it, or is a practitioner who is owning it, or the provider that is going to own it, that still is not answered legally. So these aspects have to be actually taken care by the government by bringing out right policies. As we grow on mobility, the infrastructure to really support that mobility by way of telecommunication support has to be provided. So these are definitely state constraints. If they are not going to be there, then we see a kind of constraint to growth that we are planning. If around a year back, if we were actually sitting on a very good set of around 100 customers, actually spread across geography, around 15 countries, I would have been happy to really continue with that if I were not aware of where the technology is going. That would have definitely generated around 30% growth for our organization, which would have been a kind of linear growth. Looking at the way that digital is impacting and also the way that it is getting adopted, though the adoption rates are pretty low, around 17 to 18%, I see that that has to be something that has to be a strategy for our company. We have got Swarm suite of products, a separate set of handheld device-based product for management of health for the patients. Palash practice, which is a set of product that will help the practitioners either individually or connected with the hospitals. We have a web portal, Consulting Connect, which is actually providing a platform for connecting the ecosystem together. So our strategy is actually going towards health information exchange as a paradigm and making sure that all these records are available, eventually generating the kind of database that we want to use for the big data insights that we want to actually generate for the fraternity. Now, one is where we will grow non-linearly because of this, and the second dimension would be where we will be able to provide the insights out of the big data that we will be generating. That is the second step that we'll have. That should happen actually not more than a year from now. Mainly, we want to actually go viral. So immediately we will have a free app coming up to really test the markets in not more than a week from now. Then we will go firstly to existing customers to make sure that we completely have understanding of what they think about our strategy, to make sure that they are the ones who test our strategy and actually get our own returns. So they also become our non-linear partners eventually. So we start generating non-linear revenue. Then we want to go as a next step to the international market to make sure once we have stabilized ourselves in the scalability that we require for the approach that we are defining to the international market. So that should happen in 1.5 years from now.